So hello everyone. Today I'm Dr. Ashish. I'm an joint replacement and orthoscopy surgeon. So today we'll deal with the topic called arthritis. So what exactly is an arthritis and what are the causes for it, and what are the preventive measures that need to be taken, which prevents arthritis. So first thing first, like what exactly is an arthritis? Okay, arthritis is basically an inflammation within an joint. It's not an infection as per, but it is an inflammation. Inflammation means what? Means it's an basically an mechanism wherein like a body tries to prevent the destruction. Okay, but irreversibly, yeah, after there is a damage to the tissue, so it protects itself. But in case of an arthritis, it leads to an what you call pain and all other things. So basically, majority of the joints that one of the joints leading to an arthritis are the knee joint, very common, and next is the hip, and next the shoulder, and basically any joint can go for an arthritic changes. So major is an one of the most common is a knee joint and a hip joint, and least common means less common are shoulder joint. The first joint coming into that is a knee joint. So why there is an knee joint leading to an arthritis? So basically here is a model of an arthritic knee joint. So you can see this. Okay, so this is basically an knee joint. In this knee joint, there is a articular surface. So this articular surface is very smooth, and there's a protective mechanism for this articular surface. There's a meniscus. Whenever there is a movement, so the meniscus protects. Okay, so from the agent, as the age progresses, there will be a deformities that occurs within the knee joint. Maybe a varus deformity or a valgus deformity. Maybe because of other reason. That is another huge topic that we need to discuss, but arthritis causes are many. Okay, so that causes leading to a damage within this articular cartilage, as you can see. Okay, once there is a damage, the inflammatory cascade leads. Okay, as it continues this thing, so it leads further to an meniscal injury and other leading further to a complete damage of this articular surface, as you have seen in this damage, and the pain is unbearable, and further leading to other things. Okay, so leading to gaining the weight because of inability to move around and these things. So these are the few stages, where these are the four different stages as we discussed, like early arthritis, okay, late arthritis conditions. Okay, so these are the few leading causes or the arthritic changes that occurs within the knee joint. So what is there to prevent the arthritis? Okay, first thing first is keep your joint in mobility. That means your joint needs to be mobile. You should be in other activities, like sports activities like cycling, jogging, or and swimming. They are very good physical activities to prevent the arthritic conditions. Why this is required? Basically, the articular cartilage, as I had shown you in this, like the previous model. So this articular cartilage receives its nutrition only from the fluid in the joint. If the fluid circulation within the joint is not proper, okay, so if you keep a sedentary lifestyle, okay, the articular cartilage will not get a good amount of what nutrition. So the chances of that going into an arthritis or arthritic changes is very common. Other causes are the deformities. So the deformities, why does they occur? It's one is age related, because of loss of calcium within the bones or osteoporosis. Especially in the females, it's very common, and even in the males during the age is around 60 years, very common. So leading to osteoporosis, there is a varus deformity or in outward bending of the knee. So that leading to an arthritic changes are also because the weight gets distributed on the inner side of the knee. Okay, there is a 4 to 8 times of the weight that gets loaded upon the inner aspect of the knee. So that will affect your knee joint, so leading to an arthritic changes. So in the meanwhile, so these are physical activities. So make sure that you don't gain too much of weight, and make sure that whenever you have an fractures or an knee injuries, then sports injuries like meniscus or something like that, get an early intervention. That is very important. Okay, so that you prevent arthritic changes within your knee joint. And next thing is the hip joint. Hip joint is also can lead to an arthritis. Why does it occur there? So basically majority of the causes is secondary arthritis. Why? Because of one of the main causes is the avian occurs because of the thing called an overuse of steroids and smoking, and other causes are like your chronic alcoholism. So these are the causes that may lead to an avian changes within the hip joint. Okay, so that causes an destruction with same mechanism is everything is same, but only thing is because of that reduction in the blood supply from the uh, because of all other condition, the hip joint goes into an arthritis. So basically these are the things what happens leading to an arthritis and how to prevent it. Okay, next thing is how to deal with an arthritis once it's diagnosed. So what we do is an coming to first thing is a knee. Okay, so early arthritic changes are there. MRI shows there is a destruction in articular cartilage. Okay, early arthritic changes. So depending upon the articular cartilage damage, we can repair that articular cartilage either by an arthroscopic procedure, that's a keyhole surgery that we do, or we can do something called open surgery, and we will take the articular cartilage and harvest it outside, and we will replace the damaged articular cartilage at the grafted site and also the affected site of the articular cartilage. That is called ACI, contrast implantation. So that we can do. Okay, so coming to an late changes or middle means grade 2 or 3 changes, depending upon what that you have an deformity, whether you have an valgus deformity, varus deformity. Okay, we have to correct your deformities, plus we can go in for and we can do an ACI plus or minus with the plasma therapy, that is PRP therapy. Okay, so these all are things where we can save your native knee joint, or the native knee joint means the original knee joint, which helps to make sure that the knee joint what you have is protected. Later, coming to late stages, the last stage is fourth, I mean like the last stage, where we cannot do much about saving an articular cartilage, or the cartilage is completely denuded, and there is a bone on bone friction. So too much of harvesting also we cannot do. So at that time what we do is basically an complete knee replacement. Okay, so these are all the modalities that we have. Similar thing in the hip joint, okay, or a shoulder joint we can do, but ACI and few other things are not described within the hip joint or these things. So we can do different modalities, and depending upon the stage you are in, and meeting a respective what you call respective doctors who are experts in this field like us. So it's very important. So to know about your stage you're in, or to diagnose what type of arthritis you have, you need to you need to meet a doctor when you're in pain. So get your diagnosis early and get it treated early to save your native knee joints. Okay, this is all about broadly about an arthritis. There are many conditions leading to an arthritis. Okay, so this I'll finish my talk. If you want to know anything further with arthritis, kindly contact our numbers given on the screens. Okay, and you can meet me at both Chitradurga and Davangere at two different hospitals and clinics. Okay, thank you.